Hello there, welcome back to Dewbs & Co with me, Michelle Dewberry, right through till 7 o'clock tonight. Alongside me, Daniel Moylan is a Conservative peer in the House of Lords, and Aaron Bastani is the founder of Novara Media. Lots of conversation going online. Adam Brooks, he's actually one of our, I like him, he does Dan Wootton's show actually. He's saying he celebrates, well, celebrate, it might be an exaggeration, I might have added that bit in, but he actually basically agrees with pretty much everything that you're saying on VAT. He's saying cutting VAT would encourage spending, cheaper goods for the consumer, wouldn't cost the taxpayer, will increase revenue to the Treasury and save many jobs and businesses. One of my viewers as well got in touch saying I live near Bicester Village, and he says that all the shoppers there, they do get their VAT back. I think what you're referring to is if you get your goods shipped directly overseas, so if you go to your Bicesters or wherever, then you can get your goods dispatched and get that discount, but you can't do it the way you used to, which is go to your shop, get a jacket, stick it on and get your 20% back. Those days are gone, I'm afraid. Anyway, right, let's talk medical staff, shall we? Are you a doctor, a nurse or anything similar? Would you quite fancy a life in the sun? Because an advert's been published in the British Medical Journal basically offering junior doctors in the UK, you ready, nearly 130 grand annual salary apparently, plus other perks if they move to Australia. Now, this is dividing opinion. I think I'll start with you on this one, actually, Aaron.
Yeah.
Some people are saying it's outrageous that Australia are doing this. You'll remember they had that kind of, the group that came over, the delegate came over, I don't know, a couple of weeks ago to do like a whole business recruitment event on this. Other people are saying, well, all's fair in love and recruitment because we do that to other countries. What says you?
Well, that's certainly true because we get nurses from some of the poorest countries in the world. And the World Health Organization has repeatedly told us off for doing that, rather than train our nurses here at home, which is what we should be doing, rather than lumbering them with about a £56,000 debt on average. This is really remarkable because not only is it £130,000 a year salary, £1,000 a shift, it's 20 days off a month, plus a 2-bed apartment.
You're almost selling it to yourself, aren't you? I
feel
see
like
that you're contemplating it.
Yeah, I'm in the wrong game. You know, I regret not training as a doctor. Joking aside, obviously, if I hadn't, I wouldn't be going to Australia. But it is a really, really remarkable snapshot, I think, of the fact that, particularly the right, Conservatives, they love to talk about the fact we live in a global economy, Labour's mobile, it can go here or there. If our rates of tax are too high, we won't attract investment, entrepreneurs, etc., etc. I'm sure Lord Moylan believes that, I'm sure you believe that, I believe it to an extent. But they don't seem to think the same rules apply with regards to medical staff. So we are training up doctors and nurses, and the exact same rules apply to them. If we lumber them with debt, if housing's too expensive, if quality of life is too low, and then they get an offer like this, 130 grand a year with 20 days off a month, they're going to go. And I think that's a really big consideration in terms of staff retention for the NHS going forward.
Daniel?
I don't know why you think I disagree with that. I think it's perfectly okay if somebody, a doctor, wants to take that job. That's fine. There'll be a limited number of jobs there, and those who do take them are perfectly entitled to. We don't have sort of modern slavery.
Do you not think it's a problem for the UK, though?
No, people aren't. No, people are going to take jobs elsewhere, and there is a shortage of doctors and nurses and other staff. We bring people in from elsewhere. The fact that the WHO criticises it, I think, is probably a positive because everything they say is wrong and mostly dictated by China. The fact is that's one of the best things we can do for those countries, actually, because they get
for Australia.
No, when we bring in people from overseas, they actually come here. They get the chance that they train as doctors and nurses precisely with the intention of coming here. They know there are jobs for them here. It allows them to get a better life here and send money home to support their families in their own countries. And I think it's absolutely fantastic that we take people from other countries. At the same time, I do agree with you, we should be training more people in this country, but we have a shortage of labour in this country. We've got to recognise that we've got the blessings of full employment. You know, when I was young, we had mass unemployment. Now we've got full employment in this country, and we moan about it all the time.
Have we really got full employment, or is that just a label that people say to make the government sound good?
It's an economic term. It doesn't mean absolutely everybody's working. It means anyone who wants a job can get one. That's what it means. It obviously doesn't mean you've got children working and you haven't got retired people working, but you've got people who want a job can get a job, basically. And the numbers who are unemployed through lack of choice is very, very small compared to what it used to be.
Well, there's a lot of jobs. So just in NHS England, just to give you some context, just in NHS England, there's about 130,000 jobs, vacancies that need filling, about 165,000 vacancies in social care, etc. I'm sure I'm right on this. I think that there's a list, and it's kind of like you'll have a red list, etc., which countries where this country is really kind of advised you don't take staff from there because their healthcare is in really dire straits, whatever. So there are obviously some kind of standards and all the rest of it. I would actually, if it was me running this country, which luckily for everyone it's not, I would say, right, yeah, no thanks, those days are gone. But I would say actually, if you're training to be a doctor or a nurse or whatever it is, I would set up something which is almost writes off your fees, your debts and all the rest of it if you commit and stick within the NHS for, I don't know what, just say 10 years. So then we'll write off your debt.
I think it's sensible. Yeah. I think we need to have those kinds of conversations, because what I think where we probably disagree here, Lord Moylan, is, and it's a problem that Britain's not had for a very long time, which is brain drain. We've not had it for a very long time. And if we see in this country wages continue to stagnate, it's hard to get on the housing ladder. Young engineers, health workers, computer scientists, accountants, many of them are going to leave, and they're going to leave after the taxpayer has invested in their primary, secondary, and to some extent tertiary education with healthcare workers, even though they have to pay fees as well. And I think that's a major, major problem for us over the next 10, 20 years.
Well, we've had brain drain, haven't we, from north to the south. A lot of people leave the north and all the rest of it to go to London. In terms of healthcare salaries in this country, do you think they're high enough? You've got the situation where the BMA, the RCN, they're still pushing back for higher pay rises. Do you think they should be paid more?
Well, I think it depends. I think it varies from group to group. So I'm much less sympathetic, for example, to the junior doctors, because the doctor, even if they stay in this country, apart from the opportunities overseas, even if they stay in this country, junior doctors become senior doctors, and we call them consultants, and they tend to get very well paid towards the end of their career. So it's sort of balance. So you don't get paid so well at the start, but you get really well paid later on. And that needs to be taken into account as well. Whereas with nurses, it's harder with nurses to justify that, because the career progression isn't there for so many of them in those numbers. But I think the government also has a major problem, which is the NHS is eating up a huge amount of taxpayer money, and will continue eating up more and more. And if all that money goes into wages and salaries, then none of it's not going into improvements in care, better equipment, better hospitals, things like that, which are also really important. So it's difficult for the government to get this right.
And what do you think to these union demands? I think it's VMA's about 35% pay rise, etc. Where do you stand on that?
I think it's completely sensible to give them everything they want, because
35% pay rise.
Yeah, because it's going to cost the taxpayer about £1 billion, and 1 in 3 junior doctors are looking to leave the country. I mean, understandably so, when you see a story like that. So we have an issue. Now imagine you're a business. You employ 50,000 people, and you have 10,000 employees right at the bottom of the ladder. They're just starting out in that career. You're a major multinational, and 1 in 3 of your employees are looking to leave. A private enterprise would do everything they could to keep them. And I find it absolutely remarkable that the government isn't thinking in the same terms, which is, OK, £1 billion, let's at least mitigate this problem for the next 2-3 years. How do we keep staff retention?
So what is that, £1 billion what? So you're saying
it's £1 billion to give junior doctors the pay rise that they're asking
35%?
For. Yeah, because there's not that many of them.
So you're going to give an extra 35% to these doctors this year?
Yes.
And then come next year, the nurses are going to go, hang on just a nanosecond, I only got 5% plus a small bonus.
Yep.
He got 35% last year, I'm going to go again. This time I want 25%.
Yep.
And then so on and so forth. So you're saying I would give everyone whatever it is that they want?
Not everyone.
Who then?
No, not everyone. I think the NHS healthcare is a very, very strategic industry. Without a functioning NHS, the country has big problems very quickly. And I think it's a very different situation. So that 35% figure, where's it come from? It's because in terms of their pay today compared to 2010, if they'd had pay rises in line with inflation, it would be around 35% higher.
Yeah.
So I think it's sensible to basically reverse the pay cuts that they've had over the last 13 years. That's what that demand basically consists of.
I know exactly what that demand comes from, and it's also the fact that a lot of these people, they joined that profession knowing their pay. So a lot of these people that we're saying we want to take our pay back to 2008, 2010, whenever it is.
Yeah.
A lot of these people that have started as junior doctors, they've started knowing the salary as it is now. They chose that profession on the basis of what their pay is, and now a lot of people will say it's a little bit bit rich, having took your salary today, or last year, or the year before, or whatever, to now say, whoa, Tiger, my pay should be backdated to what it was, what it should have been, years before I even joined the profession.
You're a businesswoman. Now, I know if you had a situation where you had a big chunk of your staff doing this and they wanted fundamentally not huge sums of money. I know $1 billion has a lot of money, but that VAT tax cut for tourists is approximately, let's say, ballpark $1 billion as well. So for the government, it's not a massive sum of money. If you were a CEO, you would think, I don't agree with them. You would maybe say the exact same thing, but you say, as a business person, this is a problem that I need to address. Staff retention, 1 in 3 of them is looking to go overseas. What do I have to do? No, you might not give them 35%. You might say 25%. But clearly you have to address that problem. And I think that's something the government isn't doing.
I've got so many questions for you, but Daniel, I'm conscious that I want to bring you back in.
Well, I just want to say that that money is coming straight out of the pockets of taxpayers.
You didn't say that about the tourist tax, did you?
But I don't think the tourist tax is costing $2 billion. I think the tourist tax would actually increase revenues to the Treasury.
Oh, the Treasury disagrees.
It's just but it's because they're dodgy models that they live off that they need to change.
So it's dodgy for the issues you disagree with, and it's fine for the issues you agree with.
$1 billion. I didn't know the figure of $1 billion. I'm taking that from you and not disputing it. So if it's $1 billion, it's $1 billion. But the fact is that, as Michelle said, the differentials, what used to be called differentials when we had pay bargaining all those years ago, the differentials will show up very quickly indeed, because the nurses very understandably will say, what's 35% compared to my 5%? Next year or even this year, we'll rattle, we won't even accept the 5% this year, and we'll be back on strike in the hope of getting 35%. And that will not be $1 billion when you start calling them the nurses, because there aren't just a few of them. So I think, all of that money is going to come out of the taxpayers. You say a businessman would put the
I absolutely believe that, yes.
Where would that money be coming from? Now, that would either be coming off his customers or it would be coming off his shareholders. I don't know.
Well,
but it doesn't come from nowhere.
Speaking of businessmen, press pause on our thoughts for a second, because in 2 minutes I want to get into this thing, so we'll continue this conversation, because CEOs of top businesses, the FTSE 100s, do you think they're paid enough? There's calls now, actually, that if you want to get the best talent, apparently we're not paying enough to attract them.